Right. So today we are going to be deep diving into women's reproductive health across the lifespan.
Sounds good.
Yeah. So this is like, really foundational stuff for nursing students, right? Like you need to know this stuff backwards and forward.
Yeah, you got to have it down.
We're going to talk about everything like menstrual disorders, infertility, contraception, menopause.
The whole shebang.
Yeah, the whole 9 yards.
All the good stuff.
All the juicy details from the textbook. So get ready to take some notes. Maybe grab your highlighters.
And your thinking caps.
Yes, exactly. Your thinking caps. And before we dive in, what are you most curious about when it comes to women's health?
Yeah, good question.
Keep that question in mind as we go.
Yeah.
Because we're going to be hitting on all sorts of fascinating topics. All right, so let's start with the basics. The menstrual cycle.
Okay.
I'm sure you've all learned about this in A&P, like anatomy and physiology, but in clinical practice, it's more than just a biological process.
Yeah, I heard.
It's like a vital sign. It can tell us a lot about a woman's overall health. Like if she's got regular cycles, that's usually a good sign that things are, hormonally balanced.
Right.
But when things go off track, that could be a red flag.
Exactly. Yeah, I can point to something else going on.
Yeah, like deeper issues that need to be investigated.
Yeah.
Like, for example, painful periods.
Oh, yeah.
Medically known as dysmenorrhea.
Dysmenorrhea, big word.
I know, right? Big word, but it's a common problem.
Yeah, I mean, who hasn't had a painful period?
Right.
Yeah.
But we're not just talking about mild discomfort here. We're talking about pain that can be so severe that it impacts a woman's daily life,
Oh, absolutely. Can't go to work, can't do anything, got to just lay in bed.
Right, exactly.
And pop the ibuprofen.
And it's important to, be able to differentiate between the types of dysmenorrhea.
Okay.
So there's primary dysmenorrhea, which is more common, often starts a day or two before the period.
Okay.
And is characterized by cramping, lower abdominal pain. But it's not usually caused by an underlying condition. It's just part of the normal menstrual cycle for some women.
Okay, so that's primary.
Yeah, primary. It can still be super debilitating though, don't get me wrong.
Yeah.
Then there's secondary dysmenorrhea.
Okay.
This one's often caused by underlying conditions,
Okay.
things like endometriosis or fibroids.
Those are the big ones.
Yeah, exactly. And this type of pain can be way more intense.
Okay.
It can radiate to the back or the legs.
Oh, wow.
And it can last longer than typical menstrual cramps.
Yikes. Yeah, that doesn't sound fun.
No, not fun at all.
Definitely not fun.
So let's say you've got a patient, we'll call her Izzy.
Okay, Izzy.
Izzy comes to you with severe period pain that's causing her to miss work. And she's also having trouble conceiving.
Oh, okay. So there could be more going on.
Yeah, exactly.
Yeah.
So as a nurse, what's the first thing you're going to do?
Well, I mean, got to take a good history, right?
Exactly.
Got to get into the nitty gritty. What kind of pain is she experiencing?
Great.
Has her weight changed at all? Exercise habits, stress levels, any other medical conditions?
Yeah, it's like detective work, right?
It really is. Got to figure out what's going on with Izzy.
And I remember from the textbook, the physical assessment is super important too, right?
Absolutely. Can't forget that.
Breast development, using the Tanner stages.
The good old Tanner stages.
Yeah, helps you understand where a woman is in her reproductive development.
Right.
And identify any potential concerns.
Makes sense.
And then lab tests, right?
Oh, yeah. Got to do the lab work.
Can't forget about those.
And skip those.
Hormonal imbalances, thyroid disorders, other conditions. All that stuff can manifest as menstrual irregularities.
Yeah, it's all connected.
So the lab tests can help us uncover any underlying medical issues that need to be addressed.
Yeah, got to rule those out or rule them in.
So we've got our detective hats on, we've gathered all the clues, and we suspect something like secondary dysmenorrhea. What's next?
Well, I think education and counseling are super important at this point.
Right.
Got to explain to Izzy, what's potentially causing her pain.
Right, in a way that she can understand, right?
Yeah, exactly.
Like throwing medical jargon at her.
No jargon, plain language.
And also address her anxieties about infertility.
Of course, that's got to be a big concern for her.
Yeah, and also, connect the dots between her irregular periods and other health risks. Like osteoporosis, for example.
Oh, right. Yeah, that's a good one.
You'd be surprised how many women don't realize that, their periods or irregular periods can impact their bone health.
Yeah, that's not something you think about right away.
No, not at all.
But it's important, yeah.
So yeah, it highlights how interconnected women's reproductive health is with their overall well-being,
Yeah, for sure. It's not just one system in isolation.
Okay, so let's talk about another common issue. Abnormal uterine bleeding, or AUB.
AUB.
It's like that catch-all term for when a woman's flow is just, not doing what it's supposed to.
Okay.
Like maybe it's too heavy, too light, too frequent, or just totally unpredictable.
Right. All over the place.
And figuring out the cause of AUB, it can feel overwhelming, right?
Oh, yeah. There's so many possibilities.
So that's why we have this system, right? The FIGO-Palm-Cohen classification system.
Palm-Cohen. All right, that's a mouthful.
I know, another mouthful.
But it's helpful, right?
Yeah, it helps us break down the potential culprits into structural issues, polyps, fibroids, that kind of stuff.
Okay, so that's the palm part.
Yeah, that's the palmal part. And then the Cohen part is for non-structural causes.
Right.
Like hormonal imbalances or medication side effects.
Gotcha. So palm is structural and Cohen is non-structural.
Exactly.
Okay, I think I can remember that.
So notice how we're back to those hormonal imbalances again.
Yeah, it seems to be a recurring theme.
They really are like a common thread in so many reproductive health issues.
Hormones, they're everywhere.
I know, right?
So important to understand.
Yeah, absolutely.
You got to know your hormones.
Okay, so we've got AUB. We figured out the cause. What about treatment?
Well, treatment for AUB, it's definitely not one size fits all.
Right. Every woman's different.
You got to tailor it to the individual,
Okay.
Consider the cause of the AUB, the woman's age, and her future fertility goals.
Right, because some treatments can affect fertility, right?
Exactly.
So that's important to consider.
Very important.
So what kind of treatments are we talking about?
Well, medications can be helpful. Things like hormonal contraceptives, progestins, NSAIDs, the usual suspects.
Okay.
And in some cases, procedures like endometrial ablation, which removes the uterine lining, or even a hysterectomy might be considered. But those are usually last resort type things.
Right, reserved for more severe cases.
Exactly.
So it's amazing, right, how many different approaches there are.
Yeah, it's not just one thing.
And it just reinforces how crucial it is for nurses to be excellent educators.
Oh, yeah. Education is key.
We need to help women understand their bodies, explain the potential causes of AUB, and guide them through the treatment options, including potential side effects of medications.
Totally agree. It's all about empowering women to make informed decisions about their health.
Absolutely.
And feel confident in those decisions.
Yeah. And feel like they're in control.
Exactly. It's their body, their choice.
Okay, so are you ready to dive into another topic?
Yeah, bring it on.
All right, let's talk about something that's often misunderstood and even stigmatized.
Ooh, okay. I'm intrigued.
Premenstrual syndrome, or PMS, and its more severe form. Premenstrual dysphoric disorder, or PMDD.
PMS and PMDD. All right, let's do it.
We've all been there. Right.
Oh, yeah. I think every woman has experienced PMS at some point.
Right. Like those mood swings, the bloating, the cravings in the days leading up to our periods.
The chocolate cravings.
Oh, yeah. The chocolate cravings for sure.
Can't forget those.
But it's important to remember that for some women, these symptoms are way beyond just mild discomfort,
Oh, yeah, for sure. It can be debilitating for some.
Their lives are seriously impacted by these symptoms.
It's not just a little bit of moodiness. It's a real thing.
Right, exactly.
And it often gets dismissed, which is not okay.
No, not at all. So what's the difference between PMS and PMDD?
Well, they both involve physical and emotional changes related to the menstrual cycle.
Okay.
But PMDD is way more severe.
Gotcha.
Imagine your patient is experiencing intense mood swings, irritability, depression, anxiety, and it's so bad that it's interfering with her work, her relationships, her life in general.
Wow, that's intense.
Yeah, it's really rough for these women.
So it's not just all in her head.
No, not at all.
These are real biological changes happening.
Absolutely.
In response to hormones.
Yep, hormones are at play again.
Those pesky hormones.
They can really mess things up sometimes.
So that's important for us as nurses to understand, right?
Oh, for sure.
And to communicate to our patients.
Yeah, we need to validate their experiences.
Right, and provide compassionate care.
Absolutely. Let them know we believe them, that they're not making it up.
So how do we help these patients manage their PMS and PMDD symptoms?
Well, the good news is there are multiple approaches.
Okay, that's good to hear.
And it's often about finding the right combination for each individual.
Okay, so individualized care again.
Always. That's the key.
What kind of things are we talking about?
Well, lifestyle changes can make a big difference.
Okay, like what?
Regular exercise, stress reduction techniques, a balanced diet, all that good stuff.
Right, the basics.
The basics, but they really do work.
And I've also read that certain vitamins and minerals might help, like calcium, magnesium, vitamin B6.
Yeah, those are definitely worth exploring.
Okay, so lifestyle and supplements.
Right.
What about medications?
Of course, there are medications that can target specific symptoms.
Like?
NSAIDs for pain, SSRIs for mood symptoms, diuretics for bloating.
Okay.
And in some cases, hormonal therapy might be considered as well.
So a lot of options to choose from.
Yeah, but it's about finding the right fit for each patient.
Right. And working with them collaboratively, right?
Exactly. It's a team effort.
And that's where your communication skills as a nurse are so important.
Oh, yeah. Communication is everything.
You need to listen to your patient, educate her about PMS and PMDD, help her track her symptoms and identify potential triggers, and guide her through the various management options.
It's a lot, but it's so important.
Yeah, it really is.
It's all about empowering women to manage their own health.
Absolutely.
And feel confident in their choices.
Okay, so are you ready for another deep dive?
Bring it on.
All right, let's talk about endometriosis.
Endometriosis, okay.
So remember, Izzy, our patient with the severe period pain and difficulty conceiving,
Oh, yeah, Izzy.
her doctor suspects endometriosis.
Ah, okay.
So endometriosis is a condition where tissue, similar to the lining of the uterus, grows outside of the uterus.
Oh, wow. So it's like misplaced tissue.
Yeah, exactly.
That's got to cause some problems.
It does. It can be super painful.
And it can affect fertility, right?
Yeah, it's a common cause of infertility.
So how do they even diagnose this? Like, how do they know if someone has endometriosis?
Well, it can be tricky to diagnose. Sometimes it's diagnosed during a laparoscopy.
A laparoscopy, what's that?
It's like a minimally invasive surgery where they insert a tiny camera into the abdomen.
Oh, wow. Like a tiny telescope.
Yeah, exactly.
Oh.
Yeah, and that allows the doctor to actually see the organs inside the pelvis
Okay.
and check for things like endometriosis.
So they can actually see the misplaced tissue.
Yeah, they can see if there are any endometrial implants outside the uterus.
Okay, that makes sense.
So how does this tissue end up in all the wrong places? Like, what causes endometriosis?
That's the million-dollar question.
Right.
We don't know the exact cause.
Okay.
But there are several theories.
Okay, like what?
One theory is that like menstrual blood containing endometrial cells flows backward through the fallopian tubes and into the abdomen.
Okay, so it goes the wrong way.
Yeah, instead of flowing out of the body, it flows back up. And then those cells implant and grow outside the uterus.
Okay, so that's one theory.
Right, but we don't know for sure why it happens.
But why does it cause so much pain?
Well, those endometrial implants, they respond to hormones just like the lining of the uterus.
Okay.
So during the menstrual cycle, they swell and bleed.
Oh, just like the uterine lining.
Leaks.
But because this is happening outside the uterus, it can irritate the surrounding tissues.
Right, it's not where it's supposed to be.
It can cause inflammation
Ouch.
and even lead to scar tissue formation.
Yikes. That doesn't sound good.
No, not good at all.
So that's why Izzy's in so much pain.
Yeah, and it can also lead to infertility, right?
Yeah, we talked about that before.
Right.
Those endometrial implants and scar tissue can block the fallopian tubes.
Okay.
So the egg can't travel from the ovaries to the uterus.
Right.
And it can also interfere with ovulation and affect the quality of the eggs themselves.
So it's a multifaceted problem.
It really is.
Endometriosis is a complex condition with a huge impact on a woman's life
It's not something to be taken lightly.
and is often misdiagnosed or takes years to get a proper diagnosis.
Yeah, unfortunately, that's true.
So it's crucial for nurses to be aware of the symptoms, right?
No, absolutely.
And to listen carefully to their patients' concerns
Always listen to your patients.
and advocate for further investigation if endometriosis is suspected.
We need to be their advocates.
Okay, so let's move on to another emotionally charged topic. Infertility.
Infertility. Okay.
It's often defined as the inability to conceive after a year of regular, unprotected intercourse.
Okay, so that's the clinical definition.
But for couples who are struggling to conceive, that 1 year mark can feel like an eternity.
Oh, yeah, I can imagine.
It's a long and difficult journey.
It really is.
And it's important to remember that infertility isn't just a woman's problem.
Right, we need to get rid of that stigma.
It can stem from either partner or even a combination of factors.
Exactly. It takes two to tango.
So we need to be sensitive to that and
Absolutely.
approach this topic with compassion.
Always. Compassion is key.
So in terms of like the causes of infertility,
Yeah, what are we looking at?
well, male factors contribute to about 40% of cases.
Okay, so it's almost half.
Yeah. And female factors account for another 40%.
Wow, so it's pretty evenly split.
And the remaining 20% are either due to a combination of factors or unexplained, meaning no specific cause can be identified.
Okay, so there's still a lot we don't know.
Yeah, infertility can be a real mystery sometimes.
It really can.
So let's talk about female infertility first.
Okay, what are some of the common causes?
Well, ovulation disorders are a big one.
Like,
Polycystic ovary syndrome, or PCOS, is a frequent cause.
okay, PCOS, that's a common one.
And then there are fallopian tube blockages,
Okay.
which can result from infections or previous surgeries.
Right, so there can be structural issues.
Yeah, exactly.
And we talked about endometriosis before.
Right, that could definitely play a role.
Makes sense.
And other factors include uterine abnormalities, hormonal imbalances, and even some autoimmune disorders.
Wow, so many things can affect fertility.
It's really complex.
It is, yeah.
Okay, so what about male infertility? What are the main issues there?
Well, the most common problems involve the sperm itself.
Okay.
Low sperm count, poor sperm motility, meaning they don't swim as well as they should, or abnormalities in sperm shape.
So it's like the sperm aren't doing their job properly.
Right, exactly.
So what causes these sperm problems?
Various things, genetic predispositions, hormonal imbalances, infections, lifestyle factors like smoking and excessive alcohol use, and even exposure to certain environmental toxins.
Okay, so a lot of the same things that can affect female fertility.
Yeah, there's some overlap.
So how do we go about figuring out what's causing infertility?
Well, the diagnostic process involves a series of tests for both partners.
Yeah.
For women, we typically start by tracking ovulation
How do they do that?
through methods like basal body temperature charting or using ovulation predictor kits.
Okay, so they're monitoring the woman's cycle.
Exactly.
And then there are hormone level checks
Right, gotta check those hormones.
to assess ovarian function
Mm-hmm.
and imaging of the reproductive organs like ultrasounds or hysterosalpingograms to look for structural abnormalities.
So it's like a multi-pronged approach.
Yeah, you got to look at everything.
Makes sense.
And if those tests don't give us clear answers, a laparoscopy might be recommended.
Ah, right, the little camera.
Yeah, to visualize the pelvic organs and look for things like endometriosis or fallopian tube blockages.
Okay, so that's for the female partner.
Yeah, what about for the male partner?
Semen analysis is the cornerstone of male infertility testing.
Okay, what does that involve?
It evaluates the sperm count, their shape, and their ability to swim effectively.
So it's like a quality control check for the sperm.
Exactly.
I remember reading that men need to abstain from ejaculation for a few days before providing the sample.
Yeah, that's important for accurate results.
So that's something important for nurses to know when educating patients.
Absolutely. Got to make sure they get it right.
So we've done all these tests. We've identified the cause of infertility. What happens next?
Well, then we talk about treatment options.
Okay, and what kind of options are available?
The treatment approach is tailored to the specific cause and the couple's individual circumstances.
Okay, so individualized care again.
Always. That's the theme here.
So what are some general things that can help?
Lifestyle modifications can be incredibly beneficial.
Right.
Weight management, quitting smoking, reducing alcohol intake, those kind of things.
The healthy lifestyle stuff.
Exactly. It can make a big difference for both partners.
And then there are medications, right?
Yeah, depending on the underlying issue.
Like what?
For example, clomiphene is commonly prescribed to stimulate ovulation in women,
Okay.
and hormone injections can address more complex hormonal imbalances.
And for structural problems like blocked fallopian tubes, surgery might be an option?
Right. If the tubes are blocked, surgery can sometimes fix that.
I've heard about advancements in surgical techniques, allowing for minimally invasive procedures.
Oh yeah, laparoscopic surgery is amazing.
So less invasive, less recovery time.
Exactly.
And then there's the world of assisted reproductive technologies, or ART.
RT, that's the high-tech stuff.
Yeah, it seems almost futuristic.
It kind of is.
So what does RT involve?
It encompasses various fertility treatments that involve handling eggs and sperm outside the body.
Okay, so it's like a lab procedure.
Yeah, in a way.
And the most well-known ART procedure is in vitro fertilization, or IVF.
IVF, everyone's heard of that one.
Right, it's become pretty mainstream.
So how does it work?
Basically, eggs are retrieved from the woman's ovaries,
Okay.
fertilized with sperm in a laboratory setting.
So they create embryos in the lab.
Yeah. And
Right.
then one or more embryos are transferred back into her uterus.
So they're bypassing the whole fallopian tube thing?
Yeah, exactly.
That's amazing.
It's pretty amazing.
And it's helped a lot of couples have babies.
It really has. IVF has revolutionized the field of infertility.
For sure.
But it's important to acknowledge that it can be a really physically and emotionally demanding process.
Oh, yeah, I can imagine.
And it doesn't always guarantee success.
Right. It's not a foolproof solution.
So we need to have open and honest conversations with couples about the realities of IVF
Definitely.
the potential challenges involved.
Manage those expectations.
Exactly.
So what about other ART procedures? Are there alternatives to IVF?
Yeah, there are other options,
Like what?
like intrauterine insemination or IUI,
Okay.
where a prepared sample of sperm is placed directly into the woman's uterus.
So it's less invasive than IVF.
Yeah, less involved.
But it doesn't work for everyone, right?
Right. It depends on the cause of infertility.
Okay.
And there's also gamete intrafallopian transfer, or GIFT,
It's a gift. Okay.
where eggs and sperm are combined and immediately placed into the fallopian tube.
So they're encouraging fertilization inside the body?
Yeah, allowing it to happen naturally.
Interesting.
And for cases of severe male factor infertility, there's intracytoplasmic sperm injection, or ICSI,
ICSI, all right.
which involves injecting a single sperm directly into an egg to fertilize it.
Wow, that's high tech.
Yeah, it's pretty amazing what they can do these days.
It really is.
So many options available.
Yeah, it's mind-boggling.
But with so many choices, it can be overwhelming for couples, right?
Oh, definitely. Information overload.
So as nurses, we need to guide them through the maze of information.
We're like their navigators.
Exactly.
Helping them make sense of it all.
And helping them choose the method that best aligns with their values and goals.
Right, because everyone's different.
And let's not forget about the emotional roller coaster that comes with infertility.
Oh, yeah, it's a tough journey.
It can be really stressful and isolating for couples.
And they need support.
Yeah, they really do.
So that's where our role as compassionate and supportive caregivers comes in.
Right. We need to be there for them.
Be there to listen, offer encouragement, connect them with resources like support groups or mental health professionals.
It's about providing holistic care,
Absolutely. It's not just about the physical stuff.
All right, so let's shift gears a bit and talk about contraception.
Contraception. Okay.
So we need to empower women to take control of their reproductive health
Right. It's their body, their choice.
and make informed decisions about if and when they want to have children.
It's all about having options.
And surprisingly, over half of unintended pregnancies occur in women who reported using some form of birth control.
Wow, that's surprising.
Yeah, it highlights the importance of correct usage and understanding the various methods available.
Gotta use it right and gotta know what you're using.
Exactly.
So let's break down those contraceptive options, starting with the behavioral methods.
Okay, behavioral methods, what do we have?
The most effective, although not always practical, is abstinence.
Abstinence meaning.
Refraining from sexual intercourse altogether.
Okay, so not having sex at all.
Right.
That's definitely effective,
The most effective, for sure.
but not always realistic.
Not for everyone, yeah.
Okay, so what else?
Then there are fertility awareness-based methods, or FAMs.
Dynams, okay.
These involve tracking bodily signs to identify the fertile window, those days when pregnancy is most likely to occur.
Okay, so it's like knowing your body and when you're most fertile.
Exactly.
So what kind of signs are we talking about?
Things like cervical mucus changes and basal body temperature.
Okay, so it takes some effort to track those things,
It does, yeah. It's not for everyone.
but it can be effective if done correctly.
Right, if you're diligent about tracking.
And there are even apps now that can help with tracking these signs and predicting ovulation.
Oh, wow. Technology to the rescue.
Right. It's pretty cool.
It is.
What about withdrawal, the pull-out method?
Withdrawal? Well,
Is it effective?
it's not very reliable, to be honest.
Okay, why not?
It requires perfect timing and control, which, let's be real, can be difficult in the heat of the moment.
Right, things can get a little heated.
And it offers no protection against sexually transmitted infections.
Oh, yeah, that's a big one.
So not the ideal choice for most couples.
Right, it's better to be safe than sorry.
Absolutely. Always better to be safe.
Okay, so let's move on to barrier methods.
Barrier methods. Okay.
Condoms are the superstars here.
Condoms, yeah, the classic.
They're the only method that provides protection against both STIs and pregnancy.
Double protection. Gotta love that.
And there are male and female condoms available.
Right. Options for everyone.
So it's important to remind patients about that.
Definitely let them know they have choices.
Okay, what other barrier methods are there?
We have diaphragms and cervical caps.
Okay.
Those are dome-shaped devices that fit over the cervix, blocking sperm.
So they're like a physical barrier.
Exactly.
And do they need to be used with anything else?
Yes, they must be used with spermicide.
Spermicide, what's that?
It's a chemical that kills sperm.
Okay, so double protection again?
Right. Barrier plus spermicide.
And what about sponges?
Sponges are soft, absorbent devices inserted into the vagina, covering the cervix.
Okay.
And they also contain spermicide.
So barrier methods offer a decent balance of convenience and protection.
They do, but it's crucial to emphasize that they need to be used correctly every single time to be effective.
Right, no room for error.
Consistency is key.
Okay, so those are the barrier methods.
Yep, those are the main ones.
Now let's dive into the world of hormones.
Hormones. All right, here we go again.
Hormonal methods are among the most effective contraceptive options,
Oh yeah, they're up there.
and they come in various forms.
Let's hear about it.
So how do hormonal contraceptives work?
They work in a few different ways.
Okay.
They can prevent ovulation,
Okay.
thicken cervical mucus to block sperm.
So it's like a roadblock for the sperm.
Exactly.
And they can thin the uterine lining to make it less hospitable for implantation.
So even if an egg does get fertilized, it's less likely to implant.
Right, it's like a multi-layered approach to preventing pregnancy.
Exactly. Very effective.
The most well-known hormonal contraceptive is the oral contraceptive pill, or the pill.
The pill, yeah, everyone knows the pill.
It's been around for a while.
Since the 1960s, I think.
Something like that, a long time.
It's been a game changer for women's reproductive health.
For sure. Like, it's given women so much more control over their fertility.
Definitely.
But the pill has evolved a lot over the years, right?
Oh, yeah. The first pill, it had like super high levels of estrogen.
Yeah.
And it led to some pretty nasty side effects.
Yeah, I've heard stories.
But thankfully, research has brought us lower dose formulations that are way safer and more tolerable.
That's good to know.
Yeah, it's come a long way.
And beyond preventing pregnancy, the pill offers some other perks too, right?
Oh, yeah, for sure there are non-contraceptive benefits.
Like what?
It can reduce the risk of certain cancers, regulate periods, reduce acne, and even lessen those pesky menstrual cramps.
Wow, so it's like a multitasker.
It really is.
Okay, so we've got the pill. What other hormonal methods are there?
Well, we've got injectables like Depo-Provera.
Yeah.
It's a progestin-only injection that provides 3 months of contraception with just one shot.
So it's like set it and forget it.
Pretty much, yeah. It's great for women who don't want to take a daily pill.
Makes sense. And what else?
There are transdermal patches like Ortho-Evra,
Okay,
which release hormones through the skin,
interesting.
and vaginal rings like NuVaring.
Okay.
Those are flexible rings inserted into the vagina, releasing hormones continuously for 3 weeks.
So many options.
Right. It's all about finding what works best for each individual.
And then there are long-acting reversible contraceptives, or LRCs.
LRCs, those are the heavy hitters.
Yeah, I've heard they're super effective.
They are. They're incredibly effective and convenient.
Okay, tell me more.
They provide long-term contraception without the need for daily or even monthly maintenance.
Okay, so less room for user error.
Exactly.
What kind of LRCs are there?
The most common are the implant, like Nexplanon, and hormonal IUDs, like Mirena, Kylena, and Jades.
Okay, so the implant is...
It's a small rod inserted under the skin of the arm.
Okay.
And it provides up to 3 years of continuous hormone release.
Wow, 3 years. That's a long time.
It is. And then hormonal IUDs.
Those are...
Small T-shaped devices inserted into the uterus.
Okay.
And they release hormones for 3 to 5 years, depending on the type.
So they're both long-term options.
Very long-term and very effective.
LRCs have become really popular, haven't they?
Oh, yeah, for good reason.
Seems like there's a hormonal contraceptive method for just about everyone.
There really is. It's amazing how far we've come.
But with so many choices, it can be tough to know where to start.
That's where you guys come in.
Right, the nurses.
You need to be knowledgeable about all the different methods, their mechanisms of action, potential benefits and risks, and appropriate use.
So it's about more than just handing someone a prescription.
Oh, yeah. It's about guiding women through this maze of information, helping them choose the method that best aligns with their lifestyle, preferences, and health goals.
It's about empowering them to make informed decisions.
Exactly.
Okay, so let's talk about permanent contraception. Sterilization.
Sterilization. Okay.
This is a big decision.
It is. It's typically chosen by individuals or couples who are certain they don't want any more children.
Right, it's a permanent method.
And it's highly effective.
What are the main types of sterilization?
For women, there's tubal ligation,
Right.
often called getting your tubes tied.
Right.
It involves blocking or severing the fallopian tubes,
Okay.
so the egg can't travel to the uterus for fertilization.
And how is it done?
It can be done laparoscopically, so minimally invasive,
Okay.
or through a small incision in the abdomen.
And for men, there's vasectomy.
Cystectomy,
What did that involve?
cutting and sealing the viscerins, the tubes that carry sperm from the testicles to the urethra.
Okay, so no more sperm in the ejaculate.
Exactly.
And is vasectomy a big procedure?
Not really. It's typically done under local anesthesia in a doctor's office.
Okay.
It's generally safe and quick.
So both tubal ligation and vasectomy are considered permanent methods of contraception.
They are, and while reversal procedures are possible, they're not always successful.
Right.
And they can be quite complex and expensive.
So it's not something to be taken lightly.
Definitely not. It's a big decision.
Okay, so before we move on to menopause, I want to touch on one more important topic related to contraception.
Okay, what's that?
Emergency contraception.
Emergency contraception, or EC?
It's often misunderstood, even stigmatized,
Yeah, unfortunately.
but it's an essential part of reproductive health care.
Absolutely.
So what is emergency contraception exactly?
It's a method of preventing pregnancy after unprotected intercourse or contraceptive failure.
Okay, so it's like a backup plan.
Exactly. It's like a safety net.
What kind of EC options are available?
There are a few different types.
Okay.
Pills containing levonorgestrel, like Plan B one step,
Okay,
or ulipristal acetate, like Ella.
and then there's the copper IUD.
The copper IUD, yep, that can be used as emergency contraception too.
Interesting.
So how do these EC methods work?
Well, they work by preventing or delaying ovulation, interfering with fertilization, or preventing implantation.
So they're working on multiple fronts.
They are, and they're most effective when taken as soon as possible after unprotected intercourse.
Ideally within 72 hours.
Right. The sooner the better.
But some methods can be effective for up to 5 days.
So there's still a window of opportunity.
There is, but time is of the essence.
And it's super important to debunk the myth that ECs are the same as abortion pills.
Oh, yeah, that's a common misconception.
So what's the difference?
ECs work by preventing pregnancy from occurring in the first place,
Okay.
not by terminating an existing pregnancy.
So they're two completely different things.
They are, and it's crucial for nurses to educate patients about that
Yeah, we need to clear up the confusion.
and ensure access to this important contraceptive option.
Absolutely.
It's all about empowering women with knowledge and choices.
Okay, so we've covered a lot of ground with contraception.
We have from abstinence to emergency contraception.
Now it's time to shift gears and talk about the final chapter of a woman's reproductive journey.
Menopause.
Menopause, that's a big one.
It is. It marks the end of menstruation and the transition into a new phase of life.
So what exactly happens during menopause?
It's all about the decline in estrogen production by the ovaries.
Okay, so hormone levels are changing,
Big time.
and that leads to all sorts of symptoms.
It can, yeah, it's different for every woman.
Like what kind of symptoms?
The classic ones are hot flashes and night sweats.
Okay.
There's also vaginal dryness, mood changes, sleep disturbances, fatigue, and more.
So it's not just about hot flashes.
No, it's a whole body experience.
And it's important to emphasize that menopause is not a disease.
Right. It's a natural biological process.
It's a normal part of aging.
Absolutely.
So how do we approach managing menopause?
Well, it depends on the individual woman and her symptoms.
Yeah.
There's no one-size-fits-all solution.
So individualized care, again,
Always.
what kind of options are there?
We can talk about lifestyle modifications, hormone therapy, complementary and alternative therapies.
Okay, so a range of approaches.
Right. It's about finding the right combination for each woman.
Hormone therapy is often seen as the go-to solution for menopause symptoms.
It can be very effective.
But there are potential risks, right?
There are, yeah.
I remember learning about the Women's Health Initiative, or WHI, study.
The WHI study, that was a big one.
What did it show?
It revealed that long-term hormone therapy, particularly combined estrogen and progestin therapy, was associated with an increased risk of heart disease, stroke, blood clots, and breast cancer.
So it's not a risk-free option.
Definitely not.
So the decision to use hormone therapy should be made carefully,
Great care.
weighing the potential benefits against the potential risks
And using the lowest effective dose for the shortest possible duration.
to minimize those risks.
Exactly.
Okay, so what about alternatives to hormone therapy? What if a woman doesn't want to take hormones?
Well, there are lots of non-hormonal options, too. Lifestyle modifications are a great starting point.
The good old healthy lifestyle stuff.
Yep. Regular exercise, stress reduction techniques, a healthy diet, getting enough sleep.
Those things can make a big difference.
They really can.
And for vaginal dryness, there are over-the-counter lubricants and moisturizers.
Right. Those can be very helpful.
And for mood changes, there's cognitive behavioral therapy, or CBT.
CBT is a great option for managing mood-related symptoms.
I've also heard about herbal remedies for menopause, things like black cohosh and soy isoflavones. What are your thoughts on those?
Well, there's been a lot of interest in complementary and alternative therapies for menopause.
Okay.
And while some women do find them helpful,
Right.
the scientific evidence supporting their effectiveness is still somewhat limited.
So more research is needed.
Definitely.
But it's important for women to talk to their healthcare providers about any herbal supplements they're considering.
Absolutely, because they can interact with other medications.
Right, so open communication is key. Okay, so we've talked about managing the symptoms of menopause,
We have.
but there are also some health risks associated with menopause, right?
There are, yeah. As estrogen levels decline, there's an increased risk of certain conditions, osteoporosis and cardiovascular disease.
Okay, so bone health and heart health.
Exactly. Those are big ones.
So what can women do to protect themselves?
For osteoporosis, weight-bearing exercise, adequate calcium and vitamin D intake, and medications, if needed, can help maintain bone density.
Okay, so building strong bones
Right.
and for cardiovascular health.
Maintaining a healthy weight, exercising regularly, and managing risk factors like high blood pressure and cholesterol are essential.
So the usual heart-healthy advice.
Pretty much, yeah, it's all about prevention.
Okay, so we've covered a lot of ground in this deep dive.
We have, from puberty to menopause and everything in between.
It's been quite a journey.
It has.
And I hope our listeners, especially those future nurses out there, feel a little more prepared to navigate the world of women's health.
I hope so, too. It's a fascinating and complex field.
And it's constantly evolving.
That's for sure.
So we need to stay up to date on the latest research and best practices.
Absolutely.
All right, well, that wraps up our deep dive into women's reproductive health.
It's been a pleasure.
Thanks for joining us.
Anytime.
And to our listeners, keep those brains buzzing, keep asking questions, and keep learning.
And don't be afraid to reach out if you have any questions.
We're here to help.
Always.
Until next time, keep diving deep. Okay, so we've talked about managing the symptoms of menopause,
We have.
but are there also some health risks associated with menopause?
Yeah, there are.
Like what kind of things?
So as estrogen levels decline,
Okay.
there's an increased risk of certain conditions.
Like what are we talking about here?
The big ones are osteoporosis and cardiovascular disease.
Okay, so bone health and heart health.
Exactly. Those are the main concerns.
So what can women do to protect themselves during this time?
Well, for osteoporosis, weight-bearing exercise is really important.
Okay, so like lifting weights, that kind of thing.
Yeah, exactly. Anything that puts stress on the bones
Well,
and adequate calcium and vitamin D intake.
right, got to get those nutrients
And sometimes medications might be needed too.
to help strengthen the bones.
Exactly.
So building strong bones is essential.
It really is, especially as women age.
And what about for cardiovascular health? What can women do to protect their hearts?
Well, maintaining a healthy weight is super important.
Okay, so diet and exercise.
Yep, the usual suspects.
And managing risk factors like high blood pressure and cholesterol.
Right, those are biggies.
So basically all the usual heart-healthy advice applies.
It does, yeah. It's all about prevention.
So taking care of yourself throughout life can really pay off during menopause.
Absolutely. It's never too early to start thinking about your health.
Wow, we have covered so much in this deep dive,
I know, right?
from puberty to menopause and everything in between.
It's been a whirlwind tour of women's reproductive health.
It really has, and I'm kind of exhausted. Are you exhausted?
A little bit, but it's been fun.
Yeah, it's been a lot of information, but it's so important.
It is, and I hope our listeners have learned a lot.
Me too, especially those future nurses out there.
Yeah, gotta equip those nurses with the knowledge they need.
I hope they feel more prepared to navigate the world of women's health after listening to this.
I hope so. It's a challenging but rewarding field.
It really is.
And remember, it's constantly evolving.
That's true, so we always need to be learning and growing.
Lifelong learning, that's the key.
All right, well, I think that officially wraps up our deep dive into women's reproductive health.
It's been a blast.
Thanks for joining me on this wild ride.
Thanks for having me.
And to our listeners, thanks for tuning in.
Hope you enjoyed it.
Remember, keep those brains buzzing, keep asking questions, and keep learning.
And take care of yourselves.
Until next time,
Bye, everyone.
keep diving deep.